Good morning and welcome. Really warm welcome to you all. Thank you for joining our Level Up webinar. My name is Dawn Lane and I'm the Program Manager for MLI. Today, we will talk about a normally taboo subject for some. We're going to talk about menstrual disorders, PCOS, and endometriosis. But we're going to look at it from a complementary approach to wellness. So I hope you brought your questions. I grew up with 5 older sisters. I was always inquisitive. There was always plenty of whispering and a lot of locked doors because I was really young by far, so I got locked out quite often. It was as if they had this secret sorority, and I wanted to be a part of that sorority. Whatever was happening behind those doors, I wanted to be in there with my big sisters. Little did I know that I really had no choice. I was going to be a part of that secret sorority. Okay, let's fast forward. For centuries, though, women talked about menstruation, but often through a lens of negativity, where the focus was on discomfort, pain, moodiness. We talked about, oh, I'm sorry, Auntie Flo is visiting, or my friends are here. My friends are here. And add to that some cultural attitudes and the stigma associated with the topic of menstruation stopped girls and women from taking the best care of themselves. So today, let's have some positive talk on these issues and let's get some answers for ourselves and for those females who are close to you. Our presenter today, Dr. Asante Van West Charles LeBlanc, is no stranger to the MLI stage and brings a wealth of knowledge to each topic she presents. For those of you seeing her for the first time, here's a snapshot. Just a few things about her. Dr. LeBlanc is a Cuban-born Guyanese, mother of 5. She's a wife, a doctor, a clinical densitometrist, and medicinal herbalist. Her passion is to help guide individuals on their road to optimum health. So in her practice, she integrates complementary traditional medicine with conventional Western medicine. Yes. Unfortunately, she lost her grandmother to cancer, and that propelled her to do more for persons affected by this terrible disease. She is the face and voice of the Trinidad and Tobago Cancer Society, one of Trinidad's longest-standing NGOs, and has been leading the organization as its chairperson for the past 5 years. She works to change the landscape of cancer through screening and education in Trinidad and Tobago. And she's been making strides in taking the Cancer Society into new territories, pioneering an agenda for policy change in reporting the disease and changing legislation. So we have a powerhouse of a woman with us today. Yeah? Dr. LeBlanc loves reading, listening to music, dancing, and being around her family and friends. If you know her, then you know she loves to laugh. And I don't mean any small little laugh. She doesn't giggle. She has a big, hearty burst of laughter. She's fantastic. So, with that, I say good morning and a warm welcome to Dr. Asante LeBlanc. Welcome.
Good morning, Dawn. Thank you for your introduction. Good morning, everybody. It's my pleasure to be here. Dawn has me blushing with that lovely introduction, but thank you so much. Wow. Okay, so today we're going to have a hopefully engaging and lovely discussion on just a few topics that really affect women in our society. So I'm going to share my screen now to get started. Okay. Start. Perfect. Great. Take off my subtitles. Right. Right. So today we're going to do PCOS or polycystic ovarian syndrome, endometriosis, and menstrual disorders, the complementary approach. So when it comes to menstrual disorders, I'm going to describe the normal menstrual cycle, what are different menstrual disorders that we can see, and when do we have to worry. With PCOS, the same thing. What is that? The risk factors, signs and symptoms, and what can we do for PCOS? Endometriosis, what exactly is endometriosis? Risk factors, signs and symptoms, and also then what can we do for it? Just gonna move my, just 1 second here. There's a lot of technology happening here and I need to move this thing up there, right there, go, right. So you can feel free to send your messages and your questions and I'll answer them at the end. So that's not a problem. There we go. Right. So what does our female reproductive system look like? So this is where I wanted you to see that we have a uterus, we have the cervix, which is the opening to the uterus, we have the vagina lower down, our fallopian tubes, which go from the uterus, and it connects the uterus to the ovaries. And the ovaries are where all our eggs are. So women often never realize it looks so big, but it's all located in our pelvis, which is our lower abdominal area. And it's never really supposed to be in our abdomen, so to speak, unless we're pregnant or if we have certain disorders such as fibroids or other diseases which can cause an enlarged uterus. Yeah. So menstrual disorders. What are menstrual disorders? So let me explain, first of all, the menstrual cycle. So I know a lot of us have apps now that tell us when we're expecting our period, when we're ovulating, when it's a safe time or not safe time to get pregnant, and the list goes on. So often we ask women, well, when was your last period? And they're like, let me check my app or let me check this because they can't remember. But what is our actual menstrual cycle about? So our menstrual cycle is something we start to have our menstrual cycle around the age of 13, but it can start as early as 9. It starts with, so the beginning of the menstrual cycle is bleeding. That's menses or bleeding and menstruation. It usually lasts 3 to 5 days or can go up to 7. At that time, that is when an egg has been released, it has not been fertilized, and therefore, because of not being fertilized, you are not pregnant, then the uterine lining, which was preparing for conception, getting all juicy and everything, has to now shed, and that is what the bleeding is about. After your period, day 1 is the first day of your cycle, it's the first day you bleed. After that starts, around day 12 to 16, we have what we call ovulation. Between the bleeding and ovulation, we call that a follicular phase or secretive phase. This is when we're preparing again for conception, because ovulation, when that occurs, is when the egg is released from the ovary and you then conceive or don't conceive. And then we go into a different phase called the luteal phase, which is where hopefully your body hopes you conceived and is preparing for implantation and for growth of a fetus. So a menstrual cycle will typically go 21 to 35 days. It's all hormonally controlled. Unconsciously, it's all a feedback loop. What does this mean? We have different hormones that we look at, and it's between the brain and your ovaries that dictate what hormone is released, how much of it is released, and what happens. So in the brain, we have a pituitary gland, which is a very small gland in the brain, and that sends controlling hormones to the ovaries, and then the ovaries will then release other hormones and then impact how the uterus reacts in terms of getting thicker or thinner and bleeding or not bleeding. So different phases, I explained them to you. We have menstruation, proliferative or follicular phase, ovulation with an LH surge where you can possibly conceive, and that's about 14 days after your period starts. And then we go into the secretory phase or luteal phase, which is when we're preparing for implantation. So then what are menstrual disorders? A menstrual disorder is anything that is affecting how you're menstruating. So we can have what we call polymenorrhea, which is frequent menstruation. So you're not having your typical 21 to 35 day cycle. We can have menorrhagia, which is extremely heavy bleeding, where you have to use maybe diapers or you change your huge overnight pads every hour, or you have accidents, and the list goes on. Amenorrhea, which is no period, and that can be primary or secondary. So if we're pregnant, then it's secondary amenorrhea, and we know why you're not having your period. But some people are not pregnant and don't have their periods, and therefore we have to investigate why they're not having periods. Oligomenorrhea, which is when you're having your period but very small amounts of blood, and therefore it's not a typical period. And then dysmenorrhea is it's a phenomenon which is painful periods. So extremely painful periods. So those are some of the menstrual disorders that we can see as we go through. The disorders can be caused from different levels: the pituitary gland or your brain, the ovaries, or the uterus. So for example, if we have a pituitary failure and it's not working right and it's not secreting the correct hormones, which are basically gonadotrophin hormones, that's what they're called, and it's not secreting those hormones, then your ovaries are not stimulated, and therefore you can't even have a period. And so that can cause primary amenorrhea, because there's a reason we start to menstruate at a certain age, and it's based on a cycle that occurs from the pituitary gland. Now, some genetic disorders, such as Turner syndrome, can cause us never to have periods based on that. Then we look at ovarian problems. Ovarian problems include what we call early ovarian failure, or a lot of cysts in the ovaries. So you're going to see overlap in certain topics, and that is fine. So we see cysts in the ovaries, we have functional cysts, we have cysts that secrete hormones, and therefore they impact on you having a period. And then you have uterine issues. So uterine issues include what we're going to discuss today, which is endometriosis, but then there's adenomyosis, there's fibroids, and then there's just a very, very thin lining due to lack of hormonal stimulation, and those can cause different menstrual disorders. So, sorry, let's go back. Well, don't worry, I'll go back there. Yeah. So when do we worry about menstrual disorders? If you're a young woman and you're not seeing your period at all regularly, it's not about worry, it's about why you need to have a regular period. We need to have a regular period, because if we don't have regular periods, that means our uterus is getting possibly a lot of stimulation and exposure to estrogen. And that is a risk for endometrial cancer. Not only that, as young women, some of us want to have children. It's not always a must, and don't think anybody's forcing you to have children. So therefore, you need to have regular periods, and not only that, proper bleeding to be able to conceive. So oftentimes when you go to a doctor and they say, how is your period, or when was your last period, it's important for you to give this information. My last period was X. My periods are coming every so often. These are the days it's coming, every 21 or every 35 or every 28. And you know, doc, the bleeding, I start and I stop, or I have spotting, I bleed, then I have spotting, and then it stops. And all those are important things to note to be able to tell your physician. Another thing that's important is the color of the blood. Is it bright red? Is it very, very dark brown and not coming a lot? Are you getting huge clots? Are you having a lot of pain with your periods? Are you just not feeling right the week before your period? Are you feeling totally out of it? You know, those are important things for you to understand. Oftentimes, long ago, they used to say, oh, she's hormonal. Oh, this is what's happening to her. And people don't recognize that, yes, we are hormonal, because our entire reproductive cycle and menstrual cycle is based on hormone regulation. But if we have an imbalance of those hormones, it can actually affect us at different levels of our livelihood. And that starts from our mental aspect to our physical aspect. And it's important for us as women to understand our bodies, to know what is different, to understand when we feel if we have an ovulation or not, because that is possible. When you know a bad period came, when you know, something just not right, my period has changed, because then we go into the lovely evolution of menopause. And when we start perimenopause, which is going into menopause, but not full menopause, it can go even more haywire. And then women are definitely wanted to be categorized as being more hormonal when you don't, nobody understands that it's a change our body's going through, but it has not been prepared because we have not paid attention to our bodies. So this is where I ask all women and men who are on this forum to really pay attention. So men, you can tell the women in your lives to pay attention, and women, tell your sisters and everybody else, pay attention to your body, pay attention to how you feel. What you felt at 13 is not what you're going to feel at 25, not what you're going to feel at 35, 40, and so forth. But it's important to understand, how am I bleeding? How am I feeling? Am I feeling extremely irritable? Besides wanting to eat chocolate the week before my period, do I feel totally crazy? Am I getting worse? Do I want to kill everybody just before my period or during my period? Am I debilitated? Do I have diarrhea, digestive disorders with my period? Those are important things to understand. Do I have excessive pain in my legs? Am I feeling different? Am I getting swelling in my legs? I say this to you because all of that gamut, that huge sack of things and disorders and symptoms and signs, you need to pay attention to, and you need to monitor and see if it's happening every cycle or every other cycle and so forth, because that is the information a doctor needs. That is the information we need to be able to work you up to say, is there a problem? Should you be worried? Do we have to do certain blood tests? To allow you a comfortable quality of life. You understand? So when should you worry with a menstrual disorder? You should worry if you used to get periods and you're 30 and your periods just stopped. You should be worried if your periods were going fine and then all of a sudden you find you're bleeding less. I know a lot of us might say, oh God, I need her to go. I need the period to go, but it has to go when it's supposed to go. It shouldn't go before time. So look at the quality of blood as well. Are you getting huge clots? Are you getting small clots? Don't be afraid, because clots don't mean something is wrong. It means your body is working, but it could mean that you're bleeding excessively. And why is that happening? Are you feeling more dizzy with your periods? Is that because your blood count is low due to excessive bleeding? And those things need to be understood, because you could have something as simple as a fibroid, a simple cyst, a functional cyst, or polycystic ovarian syndrome. So we need you to analyze, know your body, and not be fearful of speaking to a doctor and giving the doctor the map. So I would advise you, at least 3 months of information is important for that physician, or 6 months, because then the physician can see, is there a pattern? Is there something different? Is something happening? And especially if you want to get pregnant and you're not getting pregnant, then we definitely need that information to be able to understand what is going on. So, menstrual disorders, I don't want you, I told Dawn and team that I wanted to include it because I want you to understand what your cycle is about. I want you to understand what your ovulation is about, what your period is like, and when you should be worried, and what information you need to bring to us as physicians. Another important thing to understand is that there are many times that we may get pregnant and not know we're pregnant. So your period is actually a spontaneous miscarriage. So that might be the one-off period that had huge clots or looked differently. Don't be fearful. Don't panic. Your body is working. Once we have our body in optimum functioning state, then it's doing what it has to do. So you have to understand. And so if you see one period that's different, don't panic unless you're feeling very, very ill. Don't panic. Wait for the next period to see how it's going. So I say that to you because sometimes people get very anxious. But that being said, that's not me telling you don't go to a doctor if you don't feel comfortable. It's me saying, know your body, understand it, and don't hesitate, because no question is stupid. No appointment is useless. Speak to your physician, be one, have them rapport with them and let them understand that you understand your body, that you know what is going on, and you know that something has changed and why you're worrying, right? And also important to note is your family history. So as Dawn said, she had 5 sisters and they were older than her. So Dawn could ask all her 5 sisters, her mother, grandmother, auntie, and everybody else, how was your period? When did you go into menopause? How was this? Did you get pregnant easily? Did you have any ovarian cancer, endometrial cancer, any kind of reproductive cancer? And that is the discussion that we need to also have with our 4 mothers and our sisters, who are our sisters in blood, because those genetics can actually impact us as individuals. So it's good to have those female discussions. You know, long ago, in certain Arabian countries, when you had your period, you were put in a red tent. I don't know if any of you know the book, The Red Tent, where when you're menstruating, you go into a tent, and that's where all the menstruating women are in that village. And that is where you so-called have discussions about your periods. You know, we don't have a red tent, but we definitely need to have open discussions about our reproductive cycles, because we need to understand it. It's not about being precocious or overly open. It's about us understanding and being comfortable with our reproductive cycles, because it's our right, and that is important for us as women as we continue to forge ahead for equality, equity, and everything we need as women. Yeah? So now that I've done my political rant, we'll go into endometriosis. Endometriosis. So I showed you a normal uterus. So what is endometriosis? So just look at that picture. And all of those red circles there are basically lining from the uterus that is gone outside of the uterus. So your uterus has 3 different linings. It has ectometrium, myometrium, and endometrium. The endometrium is the inner lining. That's what gets thickened when it's preparing for conception, after ovulation, and hopefully conception is preparing for implantation, sorry. And that is what sheds during our period. So if we have endometrial deposits outside of the uterus, remember, our endometrium responds to hormonal stimulation. So just picture that in your mind. I have tissue that will respond to hormonal responses and actions, but it's not where it's supposed to be. It's outside of the cavity of the uterus. So there you go. Endometriosis is defined as endometrial tissue outside of the uterus. Again, it's hormone responsive. We have multiple symptoms, which I'll go through, and endometriosis can be debilitating. But not only that, endometriosis can cause subfertility or even infertility. More and more, we're seeing women with endometriosis around the world. We do not know the cause of endometriosis, but we do know that we have to understand it, diagnose it as early as possible, and also help these women, because some women have a lot of suffering when it comes to endometriosis. The risk factors are unknown. Some people worry and they say maybe it's our lifestyle that has changed. We're on this rat race. We don't pay attention. We're constantly going, you know, maybe, there you go. Maybe it's our diet that we're having, and also maybe some genetics are involved in endometriosis occurring or being diagnosed in us as women. I've seen many women over the years with endometriosis, and I must say, no one woman was the same. Endometriosis does not seem to want to follow any particular pattern in terms of degree of symptoms, none of that. Endometriosis seems to have a mind of its own as we speak. So what are some of the symptoms? Remember dysmenorrhea that I spoke to you about? So very painful periods, or you can even have painful ovulation. You can have menorrhagia, excessive bleeding, and that is a number 1 with endometriosis. Menorrhagia, where you have excessive bleeding, but not only that, frequent periods. So periods more frequent than they're supposed to happen. You can have pain outside of the period, because that endometrial tissue is outside of your uterus and responding to hormones that are circulating in our body, which are the estrogens and the progesterones, the LH and the FSH, and well, primarily the estrogen and the progesterone. And therefore, they can get pain because if it goes in ligaments, it starts to get thick and juicy. You get pain outside of your period. A bad ovulation crisis. So sometimes it's on the ovary. So the ovaries start to hurt a lot. So when you're ovulating, it's even more painful. You can get pain in the legs and other parts of the body that you can't describe. No one understands why you're getting this tremendous pain. Or you can get nausea, vomiting, diarrhea, constipation all in one, like a big mess, and nobody understands why. Breathing issues, because we've seen endometrial deposits in lungs even. So you can get breathing issues, chest pain, anxiety, and depression, because when all of this comes down on you as a woman, you wonder if your life will ever be normal. You know, I have women who go, there's not even 1 week in my life that I have no issues. And that is sad because we need quality of life. We don't need our periods to become our enemy. It shouldn't be. We don't need our reproductive cycle to be our enemy. It's part of our life. It's part of our genetics and our makeup. And it doesn't have to be our enemy. And that is so, so important. So these are some of the symptoms and signs of endometriosis. How do we diagnose endometriosis? So basically from the symptoms and that we get as doctors, usually a GP will get it first, and then we will refer you to a gynecologist. The gynecologist will go through everything, and they will go through ultrasounds, they will do CT scans, MRIs, they will do laparoscopy because that's almost the best definitive diagnosis, which means they're going in, keyhole surgery, and they look in at the uterus, they look around in the pelvis and at other organs to see if they're seeing endometrial deposits. And then they can take biopsies and do a histology, pathology workup. And then we do some blood workup as well to see how your hormone levels are. And that is how they diagnose endometriosis. Before I go into PCOS, I think it's important to understand with endometriosis, you know, it's a confusing illness because when you hear you have endometriosis, it can almost debilitate you in your mind, especially if you have a lot of bad periods and nobody knew and you went through a lot of years without being diagnosed correctly. So endometriosis is definitely a disease that this is why I want you to understand your periods, know what is happening with your periods, understand what is wrong and what is right, what is uncomfortable, what is not comfortable. Are you seeing a difference? Because you don't have to start with endometriosis. Endometriosis can occur years after you started your period. And that is important. And this is why you want to speak to your sisters, your mothers, and so forth to understand how their periods were, because they may have endometriosis and it may have been a lower degree and you weren't made aware of it. And they weren't made aware of it either. So you want to really have those frank discussions and know that endometriosis is not a death sentence. It does not mean definitively that you can't have children, none of that. I have treated many women with endometriosis, be it for them to help with conception, be it for them to just have a normal quality of life. All of these things are treatable. And so it's so, so important to understand that this disease should not cripple you. You can overcome it, but it's just how do we do it? And that's what we'll discuss, because all of these disorders, I mean, amazingly deal with our lifestyle, our diet, and a different approach versus only hormonal treatment or different medicines that we can give. Don't get me wrong, in some cases we need to do both, and that's what the complementary approach is about. And endometriosis is a disease that sometimes if we don't nip it in the bud, if we don't get it in time, that because of this spread in the ligaments and all over the other tissues, you get different pains. And so you're, dare I say, can be constantly in pain. But you know, the beautiful thing is that there's a cure, that there's help, and that you don't have to live in pain for the rest of your life. So that's so, so important to understand. Polycystic ovarian syndrome. So I have ovaries, you have ovaries. So up at the top here, I'm showing you normal ovaries. So you can see here, the ovaries are normal. And if we cut the ovaries in a cross section, this is what the ovary would look like. So we'll have some follicles. If you're pregnant, we might have a luteal body, but that's what a normal ovary would look like. We might have one or two simple cysts in the ovary. A polycystic ovary has this cyst in the chain, like a pearl necklace. All around here, all these multiple cysts, that's what a polycystic ovary will look like. Yeah. So what is PCOS? So it's important to understand that you can have polycystic ovaries and not have the syndrome. Yeah. So when you have polycystic ovaries, it's just that you have the cysts in the ovaries. But when you have the syndrome, it's where we see insulin resistance, hair on your chin, lack of periods or anovulatory cycles, and then you can have some obesity due to insulin resistance. That's the syndrome of polycystic ovary. So that's a polycystic ovarian syndrome versus just having a polycystic ovary, right? And a polycystic ovarian syndrome has to be diagnosed by a gynecologist most times, because you have to have the actual visual of the cysts in the ovaries, plus the other symptoms and signs that I mentioned, which is irregular periods or no periods, hirsutism, which is hair on your chin, right? Insulin resistance, which is given by being selectively plump or obese, or just a little overweight, especially around the waist area, along with the cysts and along with the lack of periods. That is the syndrome. So when people say PCOS, that is the catchphrase, but it doesn't mean everybody has the polycystic ovarian syndrome, which is PCOS. You can have polycystic ovaries and not have the other symptoms. So that basically is what PCOS will be. Risk factors of PCOS. So I'm going to talk about the syndrome primarily. So risk factors include your family history, your diet, and your lifestyle, right? Now, why am I saying that? Because if we have a very poor diet, not balanced, a lot of preservatives in our foods, using a lot of soy, a lot of hormonally genetically modified foods, that can impact on us, and we can then develop PCOS. Our lifestyle, if we're sedentary, not exercising, smoking, just not caring, not paying attention, and just there, along with our family history and our genetics, those are risk factors for PCOS. What are the signs and symptoms of PCOS? Irregular periods. Some people get periods 3 times a year. Some people get periods once a year. Some people get it every 2 months, every 3 months. Infertility, and that is caused because you're not ovulating every cycle. With PCOS, we don't have consistent ovulation in the women. And then you're infertile because you never know when you're ovulating. And infertility is defined as a year of trying actively to get pregnant and not getting pregnant. So not using any conception, any methods to stop conception for a whole year, having relations and not getting pregnant. That's what's infertility. Hirsutism, so that's hair under the chin. Now I have PCOS, so I've had all of these symptoms, but yet I have overcome it using a complementary approach and have managed to have kids, as you heard, and well, looking fine, as you can see. So again, not a death sentence, not something that will mark me or make me unable to move or work or live. Insulin resistance and obesity are also signs and symptoms of PCOS. PCOS, a lot of women come to me and they go, oh, I have PCOS. Oh my gosh, I have PCOS. It's okay. You have PCOS. If you have the syndrome, there are things we can do to help you, because what we want you to do primarily is make sure you have regular periods. The reason for that is, if you don't have regular periods, again, your lining is getting a lot of estrogen released to it, your uterine lining, and that is an extremely moderate risk factor for endometrial cancer. So we want to make sure that you have regular periods. You understand? And that helps us with your weight. It helps us with your hair on your chin. So it's very, very important. And so with PCOS, once we see a woman not having periods and we've diagnosed PCOS, from a medical standpoint, we will start treatment, but generally birth control to allow for regular periods. Yeah. So what is a complementary approach to all these disorders? I sat there and I thought and I thought and I thought. So from a medical standpoint, so complementary means we're bringing in regular medication with the complementary strategies, which include our diet, our lifestyle, herbs, acupuncture, cupping, along with medication. And that's what makes it complementary. In terms of medication, for endometriosis, generally, we would use different hormones, hormonal treatments to help you, especially if a woman doesn't want to get pregnant. They tend to use medication that will stop the period, such as Zoladex. So put the woman in early menopause then for about a year or two to allow her to catch herself, so to speak. That comes with its own side effects, because putting you into early menopause gives you more menopausal symptoms before time, and it can make you also irritable. But generally, when we do that, it's that the women have been so overwrought with the symptoms of endometriosis that we need to give them a so-called break from the periods to let them recoup and catch themselves up. But as I said, it comes with side effects, and sometimes not all women can tolerate that. Generally, we'll start off with a regular birth control pill if the endometriosis is not that bad, and therefore that will help to regulate the period. And because it controls the hormones, so it takes over your hormone feedback system. So it helps in terms of how much of the tissue is stimulated at which time, and gives a much better amount of bleeding, less pain, and and stuff like that. And then we will give patients, sometimes if they're having a lot of pain at certain times of the cycle, even with the birth control, we will then give anti-inflammatories and so forth to help with the pain symptoms. And if they get nauseous, the Gravol, and the list goes on. We also have what we call gonadotroph agonists. So that means antagonists. So that means we use hormone therapies again to help to work from the top in the pituitary gland, so as to help regulate how much hormones are released to the endometrial tissue for endometriosis. For polycystic ovarian syndrome, we primarily use metformin or glucophage and a birth control pill. The metformin we use because it helps to stimulate ovulation, and the birth control pill is used because we want to have regular cycles. So it depends on what the goals of the woman are at that time who has PCOS, if they want to get pregnant or not, to understand what has to be done and what is needed at that time. Metformin is a quite interesting drug. It's an anti-diabetic drug. So, but it was noted to give us that LH surge, which I showed you in the regular menstrual cycle, which promotes ovulation. So, and then for menstrual disorders, well, we use only the birth control pill. And as you can see, there's overlap in all of that. So I've told you about the medication. So this is the juicy part now. What do we eat? What do we do? What helps us? Can we help ourselves? Now, all you have to do now is type in Google, and you will get who can give you the cure to giving you this and giving you that. And I tell people, don't become overwhelmed. Our diets have to become more wholesome. We have to work on all those aspects. So let's start looking at the complementary approach. Lifestyle. Sorry, I just discovered these little things in my PowerPoint and got excited. So exercise. Women, ladies, men, oh my gosh, you have to want to exercise. It must be calling your name, not only when crop over come, carnival come, Junkanoo come, it must call your name. Now when Mashramani come, for those gynaes out there, we have to incorporate in our life. It's called lifestyle for a reason, and that means exercising. So especially ladies, we should incorporate weight training, because that helps a lot with our fat content in our body, which helps us because fat has estrogen, and that is what further affects our cycle. So weight training is a great fat buster, so to speak. Cardio, yoga, Pilates to keep us sane during those hormonal crises, so to speak. Not smoking, all of that is part of our lifestyle. No excessive alcohol intake, all part of our lifestyle. I tell women all the time, when you choose an exercise or you choose what you want to do, make it something you like, something you look forward to doing. So I never do the same thing every day, every week. I will do my cardio, I will do a kickboxing, I will go and have my yoga, I will go and do my weight training. I mean, my weight training is consistent and constant, but then which muscles I train on which day. And that is what is important. And this is where I want us to reset and regroup, so to speak, because during COVID, the real lockdown, a lot of us paid attention to that. But then, like, we went back from 0 to 100, but I think we're at 200 now, and we're not paying attention to ourselves. And we have to understand that without these pillars, we will not have optimum health. And without optimum health and function of our body, these illnesses, endometriosis, menstrual disorders, and PCOS are only going to get worse. And no amount of medication is going to save us. It's just going to be more and more drugs going into your body, but we're not really solving the problem. We're putting plasters on the sore. So it has to be that we make a change, that we make that decision to consciously incorporate something we like into our life. Yeah? Oh, there you go. Our diet. So what should our diet be? Our diet should be wholesome, local as possible. So I had the lovely opportunity of going to Barbados last month for about 3 days for a conference. And I enjoyed the fact that your restaurants, everybody was using almost everything locally, your local food. I enjoy that totally. And that is what we need to do every day, where we eat our local foods, what did our ancestors eat? What did we grow up on? And this is where we call on CARICOM leaders to really stimulate the agricultural industry in our region, because we can provide food for our region. We can eat what we, grow our sweet potato, get our fish. We have to look at the climate change and the impact on our environment, because we need to eat much better quality food. Limit your preservative intake. So all the red dyes, all the no MSG, I hope, excessive salt, excessive sugars, that high fructose corn syrup, the hidden sugars in foods. We need to really limit that and read a lot of labels to understand what is in what we're eating. Warming foods. So this means our oxtail stews, our broths, our fish broths, bone broths, our dal, rice, bhaji, our cook-up rice, we have to eat warming foods with spices such as ginger, turmeric, cardamom, thyme, Mariman pork, oregano, mint, all of that grow, shallot, chives, all that grow around us, shadow benny, because those are all stimulating spices, and they help to regulate the meridians that are involved in balancing our body. And those meridians include our liver meridian, spleen meridian, stomach meridian, our heart meridian, and our kidney yin yang meridians, which are very important in regulating our cycles and how we respond to hormones. So the warming spices, everybody calls me Dr. Ginger because everything have ginger, any kind of thing have ginger. But ginger is such a pluripotent spice and herb, and it's so important to incorporate these things in our diet. The cinnamons, the bay leaves, the nutmegs. The reason those spices still exist in our region, the reason they're still growing is because we need them. And that is important to understand, and that is important to incorporate in our foods. Read your labels. I was laughing the other day because my pantry used to be so full of junk. I must admit it. It's like me confessing my sins to you now. And when my family and I made a conscious decision to try and really, really eat healthier long term, and again, incorporated, not sufferation, not saying, oh God, I can't eat this and I can't eat that. It's about changing it to something we like. Moderation, balance. That's what the key is, It's not about one extreme, like I can't eat flour, I can't eat this. By the time you're done, you can't eat nothing. So it's about us just revamping. And therefore, that causes to really read through labels and see what we wanted in our pantry. And trust me, sometimes we think, you just have to read those labels. And if there's too many ingredients there that you can't pronounce, chances are it's not good for you. So about just revamp and reassess how you feel. If I feel like plantain chips now, I'll fry my plantain. You understand? Air fry my plantain. But I don't always have to have tons of plantain chips that they have preservatives, because they have to do something to keep it from going stale. It's on the shelf. So you have to look at these things, and you have to understand and make a commitment to you and your family to eat healthier. So it's not about you cooking one pot and your family cooking one pot. A lot of people, because of the quality of food that we've had to eat over the years, have become insensitive, allergic, can't do this, feeling this. And it's like, oh, we have to reset our digestive systems. We have to look at it, instead of always looking towards outside to supplement to this, to that. We have to revamp and get our bodies functioning as optimally as possible. And that starts with eating more wholesome and local foods, eating more warming foods, avoiding excessively raw and cold foods. So that means not a lot of raw carrots, raw broccoli, not a lot of, people think to lose weight, I need to eat salads all day. No, because that's a lot of cold stuff going in. And according to Chinese medicine, we want to warm the body, help with digestion to lose the weight. So that's where your salads have to be balanced energetically. And you're going to hear that word from me often, moderation and balance, because we have to add ginger to the salad, add some jalapenos or peppers to the salad, add some lentil peas or some beans to the salad, add some fish to the salad, because when you eat just cold, raw salads all the time, you're then impacting your spleen, stomach meridian, and therefore you're actually counteracting and not going to lose the weight as effectively as possible, which will then more fat, more estrogen, cause more problems. So those are things we have to look at. Like, for example, from a Chinese medicine perspective, how do I balance my kidney yin and yang? So some people don't want to eat red meat anymore. They think red meat is bad. It's not that red meat is bad. It's that excessive intake of red meat is not good for you. And it's also the quality of the red meat that you put into your bodies. So I'm okay if you want to be a vegan, a vegetarian, a pescatarian, that's fine. You have to look at your supplements and make sure you have the correct nutrients. But if you're a carnivore, omnivore like me, then I look at the quality of beef. I look at the quality of lamb that I put into my body, because Chinese medicine says lamb, pork, beef, all are good for me at a certain level to stimulate my kidney yin and yang and give me my safety deposit, so to speak, of energy and nourish my body and keep it optimally balanced. So I think it's important to understand. And, like I tell people, dal is an amazing, amazing, amazing food because it's nourishing and detoxing at the same time. Eating beans, like people say, oh, I can't have beans because then I can get bloated. If you soak your beans for 24 hours before, wash off that water, the acid from under the skin, which is phytic acid, would have gone. So then you can then cook the beans, and chances are you'll have much less bloating and so forth with those beans. We also have to look at the quality of flours, the quality of beans, because a lot of that is what is catching us, because we all know prices have gone up. So when we have to feed 6, 7 people in the household, we're going to go and look for the cheapest thing. But the cheapest thing is not always the best thing. So we really have to speak to our farmers, speak to our chicken growers, poultry farmers. Are you giving me the proper eggs? What you giving your chickens to eat? So I know what coming in the eggs, I mean, and it might sound like a lot of work, but this is where I'm telling you, don't frustrate yourself. I want you to just take it step by step and incorporate it. Make it yours. Make it your lifestyle. Because what I do is not what you can do. I could give you tips and I could give you advice, but it has to be something you assimilate and like. That doesn't mean you can tell me, well, I want to drink, smoke, eat whatever crap, wherever, chefette, wherever you're from, KFC, whatever. No, we have to look at it wholesomely and also incorporate or moderate balance into it and do better for our bodies. Because the reality is we have to change what we put into our bodies, because that impacts our hormonal system. It impacts how we respond to stress, because all of that, when your body is functioning properly and optimally, it allows for better feedback loop of the hormones, proper secretion of the hormones, and proper growth. And that is what helps us from a diet perspective. Then we come to herbs. So as I told you, the herbs can include ginger, turmeric, cardamom. I love to make a beautiful chai tea with those plus black pepper and some star anise. Black cohosh or blue cohosh, those are used generally because they give phytoestrogens. Sorry, it's raining here, so in case you're having difficulty hearing me. Valerian and skullcap, those are muscle relaxants, herbal muscle relaxants. Then you have Vitex and chaste berry. Vitex works from the pituitary gland, so it helps with proper secretion of our regulating hormones. Cranberry, which helps with pain, it helps with bleeding. So cranberry is also known as black hog. Yellow dock, which helps with blood detoxing, blood cleansing. It supports the blood flow. It supports our blood count, so to speak. Don Quai as well. And then there's a lovely formula from a Chinese formula called Sini San. And then there's another one called Guizha Fu Ling Wan, which are beautiful. Guizha Fu Ling Wan is a cinnamon-based formula and is excellent for almost all menstrual disorders. Of course, I tend to mix it up depending on the issue the patient may have. But these are herbs that can be used in combination or separately depending on your symptoms. Of course, you do need to have a certified herbalist advise you and let you know what you need and do a proper diagnosis and so forth. But these are possible herbs that we can use to help with menstrual disorders and getting your body to function optimally from a reproductive standpoint, especially if you want to have a baby and increase fertility. Right. So I thank you so much, and I look forward to all your questions because I'm sure I didn't cover everything. So I hand it over to Renee or Dawn for questions.
Hello. Well, Dr. LeBlanc, thank you for sharing such current and important information on menstruation and issues affecting women daily and possibly also affecting the quality of life that, we figure we just need to just do this. It's a part of life. Whatever comes, we'll just take. And I really want to also thank you for that little bit that you put in there on nutrition and herbs, and things that we can take naturally to help us as females to ease a lot of the symptoms that we go through on a monthly basis. So always very, very welcome and important. So I want to hand you over to Renee because we do have some questions coming in, and we want to make sure that we have time to go through as many of them as we can. Renee?
Good morning, everybody. Thank you so much, Dawn. Thank you so much, Dr. LeBlanc. All right, so our first question this morning is from an anonymous person. Well, it's a long comment and then a question. I started to see my period at age 10, and I am now at the age of 37. I still have my 35-day menstrual cycle. Do you think that I'm going through premenopause stages? Asking, as I noticed a lot of changes that you mentioned, the cravings, the feeling to kill persons. I am blessed to have no pains, but just heavy flows on days 1 and 2. I feel very weak and fatigued, but notice some clocks also on day 1 and 2, and the rest of the cycle is light.
Right. So, first of all, we would need to, you should find out when your mom or your sisters went into menopause. 37 is early to go into menopause. Second of all, from what you're saying, you seem to have regular periods. So I don't think you're going into perimenopause based on what you told me. Perimenopause, but that being said, what you're feeling in terms of the cravings, the feeling of frustration and all of that is indicative of imbalance in your meridians, imbalance in the body. And that is where you need to do a reset with your exercise, your diet, the herbs possibly to support. But I would start with exercise and diet. And well, acupuncture and cupping, I would definitely recommend, because those are balancing strategies to help get your body into back into balance. Now, you do have to note that you've also come through a tremendous stressful situation, which is the COVID-19 pandemic, and that would impact as well on your hormones. So I do not think you're going into perimenopause. It's great that you track it and you have all those symptoms. I do think you just need a slight reset. So maybe look at what you're eating, look at how you're exercising, and then take it from there.
All right, great. Hopefully she will take those tips. Moving on to our next person, also anonymous. If you have been on the Depo-Provera shot, but have since stopped Depo, but your period has not returned for the past months, when will your period return?
Right. So it depends on how long you've been on the Depo shot. And then your period will generally take between 3 to 6 months to return to normal, depending on how long you've been on the Depo shot. But if it's been for years, look for about 3 to 6 months before you get normal, because now that's a lot of progesterone that's been stopping your period. So now everything has to be reset. Your body has to get rid of the Depo that was there, revamp your whole feedback loop has to be revamped, and then your period will start to come hopefully normally. And if not, the history of you being on Depo, we would be able to regulate you again, depending on what's going on. But while you're not getting your period, don't give up, don't be stressed out, exercise, diet, and it will slowly come back.
Alrighty, excellent. Another one for you. I've seen a lot of people talk about natural remedies for fibroids, such as black seed, moringa, primrose, etc. Is there any credence to this, and is the only solution for fibroids surgical?
Right. So the thing with fibroids is that fibroids are a benign tumor of the uterus, right? And you have to look at the size of the fibroids before you think of using herbs to so-called dissolve the fibroids. Not many herbs can dissolve a very big fibroid. Well, none actually. So the tisanes, all of that, it's not going to work. So you have to look at the fibroid size, but also the symptoms and your age. Because if you have small fibroids, like a size of a grapefruit even, and you're close to menopause, then don't do anything, because they're more than likely going to shrink in menopause. So you don't have to do anything. So it really depends on the individual, the signs, the symptoms, and what's happening, and the size of the fibroids. Because if the fibroids are very, very big, and it causes the uterus to be very big, then that can impact on your kidneys. So we have to look at that from an individual standpoint. So it's not only about surgery, there's also, depending on the size of the fibroid, embolism and different things. And then if you have small fibroids and close to menopause, then there's nothing to worry about because those are going to shrink in menopause. But there are herbs that I would recommend to patients on an individual basis. If, for example, they've had a myomectomy, to take out the fibroids so that the fibroids don't come back, to allow them to get pregnant. So that definitely is something I would recommend at that time.
All righty, thank you so much. The next question here. What is your opinion on black seed oil? Does it help with the issues you discussed today, as well as these herbal weight loss teas that we are seeing becoming popular these days?
Oh gosh, yeah. So every 2 to 3 months, some new herb comes up and somebody decides that it's a panacea. It will do everything. So black seed oil for me is one of these. It helps to support wellness. I don't see it as definitely a cure for all menstrual disorders. And when you talk about weight loss teas, there's an amazing new herb for weight loss, and it's called diet and exercise. There are herbs that will help to curb your appetite, to help with your metabolism. For example, if there's something wrong with your thyroid, if your thyroid is not functioning correctly, there are herbs that we use to support the body. But there's no one herb that's going to just make you lose weight and effectively and keep it off. So don't be fooled by that. And it's important for you to always have guidance of a certified herbalist, because there are some herbs that are used in so-called weight loss teas that can actually cause damage. So if used for long periods of time. So the premise of herbal medicine is not that you're stuck on it forever and for life, is that it's supposed to bring your body back up to optimal performance and support your body. So I don't get fooled by all that you're seeing. Speak with a certified herbalist. If you're in Trinidad, then I'm available. And then, you can get the proper direction.
All righty, great. Thank you so much for that. Another anonymous comment, question. Let's read it and see. I'm in my 50s and I have noticed with my cycle, it flows for 2 days of the 5-day cycle, and then it stops and it gives me an order. I usually get it running again by inserting a Candid B cream.
Yeah. So I would definitely recommend that person see a gynecologist. It sounds like you're in perimenopause. You shouldn't have to put the Candid B cream to bring down your period. So you should be checked out by your doctor, but it sounds like you're going into perimenopause.
Righty. Next one. I have endometriosis. I am currently on Visan. Are you familiar with this drug? I have been on it for about 4 years now. I still have pain, not as severe, but no periods. Is this normal? My lining and ovaries seem normal on checkup.
Mm-hmm. So if I'm not mistaken, Visan would be one of these drugs that we use to basically stop you from menstruating. So it may have a generic name. I don't know the brand name Visan. So it's normal for you not to have periods and to have normal linings because of how it works. But I don't know your age. So if you want to have children, then they will have to take you off the Visan in order for you to get pregnant. And you also have to ask them how long they're going to keep you on Visan, because no drug should be, you have to have, if you get a drug holiday or something as well.
All right, so the next comment here says, person is in their 50s, but I'm not sure which question this relates to. So I'm going to move on to the next one. Eating healthy is good, but it's barely affordable. I'm 48 years old and have basically stopped seeing my periods for the past 2 years. On a rare occasion, I experienced light bleeding for 3 days. I don't see the question here. Probably she just wants some advice then.
Yeah, so again, that is a reason for you to go to your doctor, because if you're in your 50s and your period is erratic and not coming as it should, you are in perimenopause. So you're not in menopause as yet. So you want to have a checkup. You want your hormones checked. You want them to do a scan to see what your endometrial lining is looking like, to see what your ovaries are looking like, and to make sure everything is okay, because also the color of the blood. because that is so important. So I would definitely recommend getting a checkup. Ladies, every year you should be checked up by your GP. And if you're in your 50s and you're having issues like that, definitely let your GP refer you to a gynecologist, or even just for an ultrasound scan or pelvic scan. I mean, but a gynecologist should be involved at some point just to give you proper guidance.
Alrighty, thank you. Agree with that one. All right, we have a name now, Sharon. I've learned a lot from this webinar that we were not told by our doctor. Does everyone diagnosed with PCOS gain weight? My daughter is 19. She's very skinny. She was on the contraceptive pill, but stopped because she said her periods seemed heavier and more painful. She also has pain in her uterus in between periods. Is this normal?
Right. No, so she has dysmenorrhea and she's 19. And if the pill was making her, so that's another thing. It depends on which pill your daughter was put on. So you do have to have I would personally recommend that you go to a gynecologist to understand which pill suits your daughter, first of all. Why is she getting pain during her periods, excessive pain, or outside of her periods, and to understand what is going on, because she may in fact have endometriosis or something similar. So we need to figure out, or adenomyosis. So we need to figure out what is going on and what is happening with your daughter. So definitely a checkup between your GP and your gynecologist is needed for your 19-year-old, and they need to determine which pill is needed for her, or which can work with her. Some people the pill does not agree with, and therefore they just, we do other things like complementary, but you have to look at her diet as well, and so forth from 19.
Okay, great. Thank you so much. On to our next question. Tons of questions coming in fast and furious. Is it possible to have PCOS and adenomyosis simultaneously? Is the Mirena insert a good option for all the irregularities and painful periods?
Yeah. Yes, it's possible to have PCOS and adenomyosis at the same time. Mirena. So the Mirena is an IUD which has hormones in it, so it releases hormones. So it's basically an IUD that has the ability to regulate your period. Most people with Mirena may have a very light period for a day or have no period. Mirena for 5 years is what is recommended if you have extremely, extremely difficult periods. From a Chinese medicine perspective and a complementary holistic approach, I do not like Mirena, but I do see when the need is there for Mirena because of how much symptoms or how bad patients may be feeling at the time, and herbs and complementary practices do take a little time to work. So I often work with the Mirena and then take it out after. So Mirena is not all bad, but you have to see how you feel on it. But it does help in very extreme cases.
Alrighty, thanks for that tip. Moving on to the next one. Did I read this already? No. I am accustomed to doing pap smears every 2 years, and it was always great, no issues. I did one recently, and I was told that some cells showed up abnormal, but it's nothing to worry about. I am worried ever since, and was told to redo the test in 6 months, and then to take it from there. Have regular periods, as mentioned above, re age the age of 10.
Yeah, so what you probably got was what we call ASCAS, which is abnormal cells of undetermined significance. And therefore that happens as we get younger, our hormones change how our cells look during a pap smear. So that's why they told you not to worry and just repeat it in 6 months to a year to see if it was just a momentary change. So really and truly, I would like to say, don't worry, just repeat it in 6 months and then let's take it and then take it from there, because ASCAS doesn't mean cancer. And especially if you've had normal pap smears, more than likely it's just due to a hormonal change or some inflammatory, even bacterial vaginosis, BV or one of those, and that's caused the change. So don't worry about it until you repeat the pap smear.
Alrighty, thank you. Into the next one. I've been told that I should take inositol, I hope I'm pronouncing it correctly, to manage my PCOS. Does this prove to be effective? I have not tried it as yet.
Yeah, that's a new one on the market. Inositol is one of our hormones in our body that helps with gluconeogenesis and glucose control in our body. So now that's the latest thing. Oh, you're insulin resistant, so what you need is inositol, and then we'll help you. I personally I'm not on that bandwagon as yet. I would prefer that you try to eat as healthy as possible, exercise, because exercise helps to reduce insulin resistance on its own by producing your internal inositol. And so I recommend not using it at all unless it's at this time, and trying a proper diet, like I mentioned there, the spices, even acupuncture cupping, and just and as wholesome as possible. Yeah.
Okay, thank you so much. Moving on to the next one. I'm not sure if you spoke about it already, but what are your views on taking vaginal detox, such as yoni pearls, etc., that are being advertised on social media?
There's only one answer to that. Don't do it. Your vagina has a certain pH that it's supposed to have. It has a certain way it's supposed to be. It has bacteria supposed to be there. So, detoxing your vagina is definitely not recommended by the specialist, nor by us as GPs, nor by me as a herbalist. There are times, if you're very sick, that we do need to do something intravaginally, but there's no reason. Like, people think that their vagina is supposed to smell like a rose. Like, your vagina will never smell like a rose. It's not supposed to smell like rotten fish. It's not supposed to smell at all, really, like if you're walking, but it's not going to smell like a rose. And there's a reason for that. And so, people have to understand. And this is, again, society trying to dictate how our vagina is supposed to smell. Like where do you get off? You know what I mean? We have a certain pH. Don't douche, because when you put things up your vagina, you're then shooting possible bacteria further up where it's not supposed to be, and can cause further complications. Heating your vagina, that doesn't make any sense. I tell people, if they find you're having a little odor, if you're having a little more discharge than usual, that is not green, is not smelling like fish. Sometimes it's just a pH reset that you need, because our hormones can impact on the pH of our vaginas at different times of our cycle, as I mentioned before. So sometimes I recommend boiling a liter of water. You put a tablespoon of baking soda in the water, and then you only wash with that. No soap for a week. So I'm not telling you to push that up. I'm telling you, just wash your vagina during your shower with that baking soda water, and don't use any soap for a week, and that will help to restore the pH of the vagina.
Very interesting response there. Thank you. My next question here, 2 questions in one. If your menstrual cycle usually lasts for 28 days, and sometimes you experience 31 or even 32-day cycles, would you consider this an irregular menstrual cycle? And what would you recommend is the best oil or herb for strong menstrual cramps? And if they are best to be taken before or during the cycle?
Right. No, if your cycle varies between 28 to 31 days or 20 to 31 days, I don't think that's a problem at all. I don't see it as a big problem. It depends on if you're trying to get pregnant. However, we have to see why that is changing or fluctuating so often. Pardon me. In terms of herbs for painful periods, it depends again on the situation and what's happening. But if you ask me off the bat what you could use, I mean, sometimes I recommend tinctures, especially. So using either together, like valerian with skullcap with cramp bark. Again, I like to see a patient before I do that, because there's so many things you have to look at and understand what's going on before you prescribe. But if you tell me what can I take for painful periods, I would try one of those as a tincture. I look at the brand of tinctures that I use as well. And generally you want to start herbs like about the week before the period. And then once you have the period, you up the dosing, depending on what's happening. But you definitely you should see a herbalist or a certified medical herbalist to help you go through that dosing and the combination of herbs.
I'm hoping that person took down some notes. Moving on nicely to the next one. With every year that passes, my period has gotten worse, especially the first 2 days. Symptoms vary from migraines, intense body pains, diarrhea, etc. For the year thus far, I have stayed home 1 day every month. due to the pains. Thankfully, they have come on a Sunday, so I just take one day. I have embarked on trying to eat healthier and exercise, as these things in the past have helped. I am 40 and I have a daughter already, so I am wondering if simply making these changes should suffice going forward.
Yeah, I mean, again, it's good to see someone, but it sounds like you're on the right track. You sound like you may need herbs and acupuncture and cupping. It does sound to me from just what you're telling me that there is an imbalance in your liver meridian as well as your stomach spleen meridian. So that needs to be looked at. So again, using what I told you with the warm foods, using the herbs and spices, doing a nice chai tea, those will help you a lot in terms of making the change. I don't know which country you're in, so I would probably encourage you to follow us, Victoria Clinic, which is my practice, on IG. And I put it up on this slide, but I can always type it in the chat as well. On IG, it will be Victoria Clinic _ Trinidad. And you can then subscribe to our newsletter. You can send messages and we give tips as well. And there's recipes, for example, for golden milk, which could help you, and other herbs and stuff like that. But it sounds like you're on the right track. Don't give up. But what is happening is that there's a change. So you're going into the perimenopausal change more than likely. And therefore you have to really look at your exercise, your yoga, your meditation, your mindfulness, your diet from now to start preparing the body for the change. Root vegetables are very good. So the beetroot, the sweet potato, the cassavas, and the yams are also very good, as well as the breadfruit, along with your beans and your greens, and eating as local as possible. And maybe just try that. And if anything, you can reach out to me via my socials again.
Okay, great. Thanks for sharing that. Moving along nicely. My daughter's cycles are getting progressively worse with pain. They're getting older and they're in their 20s, so it's bad. It's bad to the point that they're trembling with pain. Any suggestions to help?
Well, they need to see a doctor to figure out why they're getting the pain. Is it endometriosis, adenomyosis? Is it big cysts that are happening? What is going on? Sometimes it's just dysmenorrhea, functional dysmenorrhea. So they need to be seen by a doctor. And then, I mean, I would also consider acupuncture to help them, as well as herbs. But I mean, they need to be assessed for sure, because you don't want them to continue to hate their periods and keep going on and on and on. And then, they reach their 30s debilitated.
I think that's it. We always think we have to suffer silently when we don't have to.
Exactly. Yeah. There was that thing where you must just shut up and take it. Like whatever happened, it's your period, deal with it. That's a woman's work. That's what you have to do. And that's what we're saying. No, you're saying that you have to have a discussion, because we don't have to suffer in silence,
Exactly. Thank you. All right, moving on to our next question. I know you mentioned this earlier, but maybe this person missed it. What can you do for pain with endometriosis?
So generally, I recommend a herbal concoction that I make called Easy Flow. And then I tweak it to the person's individual response. Acupuncture and cupping for sure. And in terms of herbs, there's no one herb for endometriosis. You have to see the patient, understand what they're going through to create a customized formula for them in most cases. But if we're talking medication, then you have to go to the specialist or to us, and we do anti-inflammatories such as Flamar, Oropan, and so forth, warm water bottles and so forth. But we have to understand when you're getting the pain, when is it associated, what can we do? So it's a lot more complex than you think, and therefore you definitely need some guidance from a professional.
Okay, got you there. All right, the next one. Is constipation associated with perimenopause?
Yes.
Oh.
So, our hormones do some amazing things. So if any of you have been pregnant, you'll see what happened during your pregnancy. One trimester, you were nauseous, vomiting, crapping, next one was all happy, or you puked your guts out all 9 months, So our hormones act on our bodies differently as individuals. So perimenopause can cause constipation, but you have to look, are you getting constipation alternating with diarrhea? What are the symptoms? And get a proper workup, because we can't blame everything on perimenopause. So you need to see your doctor, explain your symptoms, get a proper workup. You may need to have a colonoscopy done to understand what's going on. Ensure there's no other reason for that constipation before we blame perimenopause.
Really? all the things we as women have to go through. All right, the next question. What can cause you to have an ectopic pregnancy?
Ectopic pregnancies. Ectopic pregnancies can be caused by if you had a lot of pelvic inflammatory disease or infections in your youth when you were younger and your tubes are blocked, then the egg does not travel. Once it's conceived, it's not passing through to go to the uterus. And then sometimes there's no real reason for why the ectopic happens. But basically, it's a pregnancy that happens in the tube itself, the fallopian tube. And therefore, most times, if you're lucky and it's caught in time, they can take the pregnancy out the tube and save the tube. But sometimes they can't. And therefore, you lose a tube. And therefore, you lose 50% chance of fertility. So it's important to really understand why we say safe sex, not having a lot of infections, getting a regular pelvic exam, checked out every year, your annual, understand, discuss with your doctor, because those things are important and can impact later on. Chlamydia is a big one for causing blockage of the tubes and therefore causing ectopic pregnancies to occur because the tubes are blocked.
Okay, interesting. Thank you so much for that. All right, our next question here. I've noticed that I usually get breast pain right before and during the first few days of my cycle, but one breast hurts noticeably more than the other. Is this a cause for concern?
I don't know how old you are. And maybe, I don't know if MLI saved my breast cancer talk. I'm sure one will come this year again. Hint, hint. But but no, that's normal. But that means, but as a woman, you're still supposed to do your monthly self-breast exams. So at least 5 days after the period has stopped, you do your self-breast examinations, understand your period, go to your doctor for your annual breast exam. And if you're over 40, to have your mammogram and ultrasound if needed once a year. So it's normal because of the hormonal influence pre-menstruation and during menstruation for your breast to be engorged, because that's exactly what happens in pregnancy as well. If you were ever pregnant, can be normal that one breast feels more tender than the other, but you still need to make sure that you're doing your breast examinations and your self-checks, your annual checks, and your mammograms if you're of age, and look at your family history as well, because we also have to rule out breast cancer. But because it's cyclical, more than likely everything is normal, but that doesn't mean you don't do your checks when you're supposed to.
Really, thank you so much. And yes, our previous recordings are on our YouTube page, so feel free to go and check them out. And you'll see Dr. LeBlanc and her other breast cancer webinars. All right, the next one is a comment. Many thanks for this session, which was very informative. Kudos to MLA team and the doctor. Thank you for answering my questions. I would like to have a one-on-one with you, doctor, but given how I would worry and it would contribute to my current health situations, I think I will just focus on my diet, health, and try to be calm and do some stuff to calm me, like reading and listening to music. Thanks again, MLA, and thank you, doctor.
Yeah, and to that person, don't panic. We all can be overwhelmed by a lot of our illnesses or imbalances in our body. So do your diet, do your exercise, do your reading and listening to your music, but consider, meditation, mindfulness, chatting with friends. Don't not reach out for help. Don't let worry basically incapacitate you from getting the help you need, and don't let it rule your life. And don't let any illness define who you are as a woman or a person. So definitely reach out. I mean, on my socials, even anonymously, you can send me a message. Just tell me from MLI, and then I will answer you and liaise with you. Don't suffer in silence at all. But kudos to you. Do the diet and exercise and enjoy it. I love what I do now in terms of changing my lifestyle.
Excellent. All right, moving on to the next one. I had a C-section 16 years ago, and I recently joined the gym. While doing abs, I felt like something ripped inside of me, and the area was sore. Should I resist the gym for a while?
No, you probably have adhesions due to the C-section. So just go to the doctor, get it checked out. They more than likely will send you for a scan, a CT scan of the pelvis, but don't stop the gym because of that. See what's happening first, and then we can make that decision.
Alrighty, thank you. Question here. If you suffer from anxiety and you often experience an irregular period, or the period has not arrived based off of what the app predicts, and in brackets, she has late by 2 days, what would you recommend to overcome that anxiety?
Cinnamon tea. Cinnamon tea is a great anti-anxiety herb, cinnamon itself. But I mean, don't panic. 2 days is not a bad thing. Your app probably is the wrong app because there's some apps that are totally whack. So if you have a lot of anxiety and you're not doing anything you're not supposed to do, then you shouldn't be so anxious. But cinnamon tea, tulsi, if you're in Trinidad, or holy basil, or you could get tulsi online as well. Those are nice teas to use along with chamomile. But when you're using chamomile for anxiety, I definitely recommend 2 tea bags to a cup, and I recommend the Twinings brand. Or there's also yogi teas. I don't know which part of the world you're at, but yogi teas. Yogi teas have an anxiety blend, and I actually know the formulator for yogi, and those are very good therapeutic teas. But you could do 2 bags of chamomile, 1 stick of cinnamon, and drink that tea twice a day, and you should be fine. I mean, and then acupuncture is also what I recommend as well.
Alrighty, thank you so much. Next question here. My daughter is 11. Her first period started last December. It comes every month, but it's pale red and lasts maybe 3 days. Should I be concerned?
No, because she hasn't had a year of periods yet, so you shouldn't be concerned.
Righty, thank you. I think this last comment is responding to what you just said. Thank you for making me feel a little better, but still, before you know it, I will start back to think again and feel worried again.
Drink lots of cinnamon. And I mean, it's hard to tell somebody who is a worrier not to worry, because
Yeah.
they'll worry about not worrying. So I think it's embrace your sisterhood. Really and truly, this is where mental health comes in, and knowing how we are, and getting that 1 or 2 friends that you can count on, exercising with them, chatting with them, having that sisterhood and brother sisterhood, if dare I say, and friendships, that you can really depend on, because we need to come out of ourselves and not keep the overthinking. But if it's really bad, I mean, there are herbs that can help you not worry, so to speak, and balance your mental as well.
Mm-hmm. Great, thank you. Thank you for those tips. Another question here for you. You talk about abnormal periods in PCOS. My daughter has been diagnosed with PCOS, but she has gone from irregular periods to a period which has not stopped for over 2 months. What is this?
She needs to go to the gynecologist to see what's going on, because her periods are behaving erratic, and also we need to know what medication she was put on. So definitely needs to be seen by a gynecologist and observed, and also treated, because you shouldn't have a period that's not stopping for 2 months.
All right, next question. When should I worry about my period not ceasing and me going into menopause?
When? Well,
yeah,
it depends on how old you are. It depends on when your mother, your grandmother, your sisters went into menopause. So it's really not about worrying. I mean, usually our periods will stop by 6 to 65. So, it really depends on your body and how it's functioning, but you should, again, make sure you do your annual checks, make sure you're doing your pap smears and all of that, and make sure you're getting checked out, and your cycle is being monitored by your doctor as well. But I don't think you should be worried. Not if you're seeing a normal period. That just means you're very fertile. Maybe you should just be cautious.
Alrighty.
A Janet Jackson or one of them,
All right, our next question here. We're seeing girls having periods younger and younger. You mentioned some as early as 9 years. Why do you think this is happening? And is it possibly linked to what our children are eating?
Oh, hell yes.
Oh.
You gave the answer. I mean, yeah, hell yes. And that is why I told you, look at the quality of chicken that we eat, poultry and beef and all our eggs, because the hormones that they put into the feed, and also the antibiotics impact on our hormonal system. So we have to look at what we feed our children from now. So that's why like a person made a comment, eating healthy is not affordable. But then when you look at it, eating unhealthy is just as not affordable, because then you have to pay medical bills. So you have to figure out where you want to put your money, because you can have a yard fowl, you can speak to your neighbors, you can speak. I hate when people tell me I can never eat healthy. Because if you don't make that effort, you don't go to the market, you don't speak to those growers, you don't understand what's going on, we're just making excuses. I understand that prices have gone up. That definitely is understandable, and totally agree with it. And we can't all plant a kitchen garden, because God knows we work very hard, and God knows we don't have the time all the time. But we cannot just throw up our hands and say, well, we're going to eat KFC, Chef at Royal Castle, whatever the hell we want, or the chicken breast look like $2 a pound versus a healthy smaller chicken breast of $3 a pound. So I'm going to go for the two, when it's filled and packed with hormones that's going to kill you. So we have to look at the quality of food that we put into our children and our mouths, and make that, we're the consumers. And we're the ones, there's a simple law in economics, it's supply versus demand. And if we don't demand crap, they can't supply crap. So we have to make that change. We have to give back and push back so that they understand. And if we don't do it as a huge revolution, then it's not going to work. And we have to call on our leaders to do better. They can't just give us lip service. And these are things we have to do as a people to save our lives, because if not, we're not going anywhere very fast.
I'm going to stand and give you a round of applause for that speech. Thank you. Thank you for that. All right, I know we're running out of time, but I'm just going to squeeze one more question in. Can medication for other medical issues cause a woman to develop PCOS or other menstrual problems?
Yes. So that is why you have to be looked at, because certain medication can throw your period off, can impact on your menstrual cycle. So you have to look at side effects of other medication, like even from chemotherapy to treatment for fibroids. Different things can affect your menstruation and your menstrual cycle. So you do have to look at that.
Great. Well, thank you so much, Doctor. I'll hand back over to Donna. In your wrap up, someone is asking if you can just share your socials, your website, etc.
Yes.
So they can reach out.
Should I put that? Let me see. How do I put this here now?
If you put it in the chat, I will post it so that they can see it. Okay,
so let me figure out how to post it in the chat first. Oh, there you go. That works. Okay, so my website is www.victoria-clinic.net. Then my IG is Victoria Clinic _Trinidad. And my Facebook is Victoria Clinic. And I'm getting TikTok. I have TikTok. I'm so ashamed of myself. I can't remember the handle of TikTok. But my daughter, my daughter has started my TikTok account. And I think it's Victoria Clinic, but it's now starting, so there's no info yet on it. So it's there.
No problem. Thank you so much. Back over to you, Dawn.
Oh my gosh. This always a pleasure. Always a pleasure, Dr. LeBlanc. Well, Renee, first I want to thank you for moderating. The questions were amazing. As I said, bring your questions, and you did just that. And to you, Dr. LeBlanc, for being here and helping us to understand that we are not stuck with our lot as women, and that we should not suffer in silence. We should not be going through pain and figuring, okay, this is it. Let me just hope that, in a couple of years, usually 40 plus years, I'll get over this. So thank you very much for sharing this information and helping us to get those questions out and answered, not just for ourselves, but for the females in our families. And I want to take the opportunity today especially to thank our audience for being so candid and posting those very personal questions so that you can get your answers as well. I'm happy that Dr. LeBlanc has shared her information. So as she said, reach out to her. You can do that anonymously. But the important thing here is to get those questions answered and to find help for yourselves and your family. So thank you very, very much. And Dr. Blanc, as always, thanks for sharing your knowledge with us. Always a pleasure to have you. Yeah.
Thank you so
Wish we
much.
could go on. You're welcome. Wish we could go on and on and on. But I have to wrap up now. So I want to say we've come to the end of our webinar. I know that someone had asked earlier if this is recorded, and in a few weeks you will see it on our YouTube platform. So it's going to be there for all to see. You would be able to access it, the females in your family, the gents who need information for their families. So it will be posted on our YouTube channel. So I want to thank everyone for joining us today. I want to remind you that programs such as what we did today, as well as our calendar of events, our blogs, can be found at www.masseylearninginstitute.com. So visit us there, leave your comments, see the programs that we have. For August, we're going to be looking at expectations of a Massey leader, performance management, IR for managers, EI, emotional intelligence, and Listen Like a Leader, our signature program, and much, much more. So just go right there, log on, and feel free to reach out to us. So until next time, we remind you, continue to level up. Level up. Bye for now. Thanks for joining.